Here I am. I just arrived at my patient's, actually my last patient of the day. I just figured I'd do a quick video. I'm here a little early and I wanted to just share how I initiate setting up for my patients. Basically, upon arrival, I set up everything based on the type of treatment that I'm going to be rendering. So if I'm giving, say, treatment for someone that has an issue with their lower back, I will definitely open up my treatment table. I have different tools, as you can see here, packed down, ready to go, depending on what I need. And I simply, sort of like a portable gym, if you want to say, or a portable physical therapy clinic, which is more of what it is. I can actually set it up according to the patient's needs. So I always prepare ahead of time. I have basically a variety of different tools that I use based on what I'm treating. Sometimes it could be anything from, of course, my hands, using certain type of pain relief gels, also certain massage creams or massage gels that allow me to have a certain amount of friction, but not too much, so that I can feel exactly what I'm trying to work on. I can break down scar tissue that way. I can get through any kind of adhesions that take place after surgeries or that may take place after certain types of injuries. Predominantly when there's injuries that may be progressing a little further that have not been addressed at an early point, you're going to have scar tissue that may develop, adhesions that may develop, which basically is how our connective tissue fibers bond themselves or bind themselves together to try to heal, try to repair injuries. The problem is when there's too many of those forming, you develop stiffness, tightness, restrictions that limit your ability to move without pain, and also can lead to issues that develop at elevations in areas around joint surfaces, things that block the movement of your joints and also limit the free movement of your muscles. The fibers can actually get caught in places that it shouldn't, places that it should glide nice and smoothly. Now they start to say get stuck, or even if you think of like a speed bump, it sort of goes through like a speed bump and you hear that little clunk, little bloop kind of sounds, all kind of weird noises when you're trying to simply move your arm or move your legs or bend your back forward and backwards, side to side, turn side to side, all those kind of things. So, you know, basically with my session today, I'm setting up for a patient that has an ankle injury. So I'm gonna set my treatment table up. I'm gonna work on her in a different way to target deep issues that bother her, or an issue to her around her ligaments in the outside part of the ankle. Basically the talocrural joint, which is where the ankle meets, but also around the anterior talofibular ligament, so the outer side of the ankle, the side that goes away from the other foot. So that is what I'm targeting today. I'm going to be doing different things to work also on her balance and proprioception. So basically working on her being able to control the movement of her ankle with her foot in contact with the ground surface, so that way she doesn't put herself at higher risk for re-injury, which would basically be stepping on something that's a little uneven and twisting her ankle, rolling it over again, which can be very painful, very traumatic, and also cause a longer period of healing, because every time you re-injure it, you cause greater risk of recovery. So for her, I'm trying to get her to be a point where she doesn't re-injure it, because she's had little micro injuries since the original one. She's not in the most fit individual. She doesn't exercise regularly, so, and she's a little older in age, so all of that impacts her. But we are going to push hard and we're going to make progress. This is Hit Fit Therapy, mobile physical therapy, fitness and wellness programs, and I will be providing care to my patient, and I hopefully can provide care to other people that are in need. Reach out to me. Look at my Facebook page. You can find a lot of helpful tips about your health, wellness, and recovery. Thank you for joining me. Take care. Bye-bye.